Hello, I'm Dr. Brandt Gibson, and tonight, well, it's actually this morning, I'm actually a little bit late getting on because of flying to Columbus, Ohio, and I'm in Atlanta right now. But tonight I want to talk to you about persistent pain and how it applies to peripheral neuropathy. So one of the problems with peripheral neuropathy is the discomfort, the pain. Truthfully, it's the biggest problem. It's the biggest reason that people actually go get treated and go get seen by their physician, is to treat the pain and to find a way to treat that pain. So with persistent pain as opposed to chronic pain, you start looking at the pain differently. So the most common way that this has always been called is chronic pain. I have chronic pain, which means you have pain all the time and it's not getting better. Whereas persistent pain, as brought up by Dr. Roper in the Neuropathy Secret Summit, is a better way of looking at that. Persistent pain is something that can be treated, that is currently happening every day and happening all the time, but that is a temporary problem that can actually be treated, can be evaluated, and something can be done for it. So the way that I recommend that you look at your neuropathy pain is that as a persistent pain, because that gives the power back to you. So the interesting thing about words, the interesting thing about way that you say things, is it creates a perception that allows you to take control. So as opposed to a pain that is chronic, nothing's going to happen, nothing can be done for it. Persistent pain is a pain that can be treated if you find the right tools and the right ways to treat it. So the way that we're finding that you can actually treat persistent pain and actually eliminate it or at least reduce it is through 4 different methods. Number 1, you can treat it through re-education. Through re-education, you're actually using a machine such as a Calmer machine, where it's actually causing the nerve to send the signal correctly to the brain, which reduces pain. So instead of having the malfunction of the nerve where you're saying, okay, I'm stepping down, and instead of feeling touch, I'm feeling pain, with the Calmer treatments, you can actually get to the point where the brain actually is starting to understand it correctly again. Re-education is the first one. Number 2 is a form of repression. This is a common way that pain is treated, such as using certain types of medications. The best ones that we found as far as repression is CBD oil or essential oils, where you actually rub them on and they'll decrease the pain. Some forms of anti-inflammatory sometimes will reduce nerve pain as well, but they're usually not quite as effective. Repression can also be done through neuro-linguistic programming using the mind, or it can be done through meditation, those kind of things. Number 3 is repair. If you repair the nerves, you're going to actually have a decrease in the symptoms there as well. And number 4 would be reset, where you actually through a machine such as the Neurogenics, you can actually depolarize and repolarize the nerve, causing them to work again and cause them to reset. So this is some of the options you have for persistent pain. Again, persistent pain because it can be treated, as opposed to chronic pain, which is going to be there forever. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 185. Persistent pain. Thank you, and have a great rest.